This is Problem Solved, the IISE podcast, where we talk to industrial and systems engineers about their work, ideas, and solutions.
Hello, everyone, and welcome back to Problem Solved, the IISE podcast. Our third season begins here. I'm David Brandt, Digital Strategist for the Institute of Industrial and Systems Engineers, and we're opening this season with 3 separate episodes featuring interviews with the keynote speakers for the IISE Lean Six Sigma and Data Science Conference, taking place live September 20th through the 22nd at the Grand Hyatt Buckhead in Atlanta. In part 1 of our triple hit premiere, IISE's Director of Continuing Education James Swisher chats with Joyce Siegele, Director of Productivity Management at Northside Hospital in Atlanta. You can learn more about our conference program, registration, and health and safety measures for the event by visiting our website at iise.org/Lean Six Sigma. And if this is your first time listening to Problem Solved, you can go back and download our first 2 seasons at podcast.iise.org or wherever you find your favorite podcast programs. In the meantime, let's begin our new season with Northside Hospital's Joyce Siegele.
Please welcome Joyce Siegele, Director of Productivity Management for Northside Hospital in Atlanta, Georgia. Joyce, thank you so much for joining us today. Can you tell us a little bit about yourself?
Sure. Thank you, James, for having me. I'm excited to be here today. So I come from an industrial and systems engineering background. I received both my bachelor's and master's from the University of Florida, and I started out with IISE as a student and have been a member ever since. So very excited to be here sharing today.
Hooray.
Yes. So since graduating with my master's, I've been in healthcare ever since. I did consulting for a little bit over 3 years right out of completing my master's degree, and then I've been at Northside ever since then. So from a professional association, not only with IISE, I'm actually been very involved with Society for Health Systems. I was on the board of directors and also served as a former president and have been very involved with the society and the organization. And so I'm very excited to be here today to share with all of IISE about everything that's been going on in healthcare over the past year or so.
That's awesome. Thank you so much, Joyce. And thanks for all of your service to IISE and SHS. You're just a delight to work with, and I can't wait to learn more from you. And of course, we're excited to have you as a keynote speaker at this year's Lean Six Sigma and Data Science Conference. And it's I guess it's hard to talk about healthcare and data science these days without talking about COVID. So I apologize for making that a topic today. But I was interested in just thinking about the role that data has been playing during the pandemic, and what have you seen healthcare providers? How are they using data to monitor changes in the pandemic and monitor what's going on in real time? What kind of tools are you seeing folks use to stay prepared in healthcare?
Yeah, that's a great question, and thank you for asking it. I think that there's a whole gamut of data that we're looking at. I think as far as like trying to be able to know, what's coming next or what's around the corner, I know that we actually have some of the folks, that have been very active with SHS have been involved with helping develop some modeling tools at their organizations that they have shared, and they've even been published, I believe, and can go find them out on the internet as well as other channels. But really, it's been a lot of trying to tap into the different, whether it's governmental agencies or, more from a local or state standpoint. There are a lot of resources out there and a lot of folks that have been helping to provide that data so that we can have an idea about what's happening and what's going on. But more specifically down at the organization level, I think a lot of it has been trying to trend and track, exactly what is happening with our COVID-19 patients. What are we seeing from, the volume of them showing up? But in addition to that, what is their severity of illness? we have COVID-19 patients show up that they may need just, minor levels of treatment and then they're able to go home. Whereas then we have the extreme cases of where we have patients that end up having to spend several days, if not weeks, in the hospital. So being able to understand the severity of their illnesses in addition to the volume has been very helpful for our healthcare providers as they're trying to take care of our current patients, but be prepared for what's right around the corner.
Sure. That makes a lot of sense. It sounds like a lot of work to sort of take that external macro data and then combine it with, what's happening at the organization level so that you can really get a sense of both the local data and maybe the broader environmental data and make some decisions from that.
Yes, definitely.
Maybe switching from data for a second and thinking about the human aspect. It takes people to provide healthcare. How are you seeing burnout affect, staff in healthcare facilities around the country? Is that a big factor? And if so, how are folks addressing that?
Yeah, that's a great question. And I think, as we look at the life cycle of what we've experienced over the past, 15 to 18 months now since, COVID-19 really hit the healthcare organizations. I mean, I think it's kind of had different points as well with the burnout of our staff. I think initially, we were having to make sure that, we were able to have our healthcare providers be educated and be able to help, provide the care that these patients would need, which is slightly different than anything we've ever had before. But then being able to, months into it, be able to recognize and understand, are they experiencing burnout? What can we do to help support our staff members? And so just some examples of some things to do is, if you think about like a typical inpatient nursing unit, you don't necessarily want to have all the same staff members that are out of that home-based unit just taking care of COVID patients. So,
Sure.
Just as an example, at one of our facilities, we were able to set up like a rotation so that, that everybody, basically had a turn helping to take care of the COVID-19 patients so that it wasn't burdened on any one particular, group or department as far as having to do that. So that definitely helped. I think too, recognizing and listening to our staff members, what do they need? What can help them so that they don't experience burnout? Because they're in a whole different environment of, we may have had isolation patients in the past where there may have been just a few per inpatient floor, whereas now maybe the entire floor was the COVID patients and they were having to wear the personal protective equipment, or PPE as we call it, all the time. So what are some things that we could do to help that? So another example I think that several healthcare organizations did was they actually put what they called in place maybe a runner or an outside person. So once the staff member, the clinical staff member, was actually physically in the room with the patient and they may have forgotten something. So instead of having to totally, undress, get the item and redress, we're able to provide some support roles of being able to help go get things for them that they may not have realized that they need to help save time and even some of the stress of having to go through that whole process again when they may have just done it to get in and spend some time with that patient to help meet their needs.
That's a great example. And has that been a way for non-clinical folks who aren't on the front line of care to sort of get involved and help out in roles like those runner roles or other roles?
Sure, definitely. And I know that, I listened to, I know we have some other podcasts out there about a year ago where we were specifically talking about, healthcare and COVID-19 and some things like that. So, definitely, having kind of all the skill levels be involved in whatever form or fashion they can, and recognizing the fact that even if they're not a direct care provider, they're still helping to take care of the patients, whether they're in a support role or an ancillary role, and they're still having to help be here in order to make the healthcare organizations be able to run so that the direct care providers can take care of those patients. So yes, it has created some new opportunities. When we think about the fact that we've had to set up, visitor screening stations, we've looked at what are the appropriate skill levels to be able to do that so that we can keep our clinical folks, our direct care providers, more up taking care of the patients that need that extra care or higher acuity, and then using some different skill levels to greet our patients as they come in to help screen them and make sure that they're safe to be here. And again, that whole process has evolved over time, and I think we're at a different place today than we were a few months ago, and definitely a year ago as far as that goes. So yes, being able to utilize all of our different skill sets and be able to give them opportunities they may not normally have.
That's great. And that's a great segue too. I'm thinking about so many different opportunities for industrial and systems engineers to contribute to new processes that that the pandemic has spawned. And one of those, I think, is maybe vaccination sites. And I think about that as having this kind of traditional supply chain component to it, but it's also got a productivity management and labor management component to it. It's got a whole queuing system.
Yeah.
There are lots and lots of different IISE components to vaccination clinics. So how have you seen organizations kind of address those logistical challenges in setting those up?
Yes, that's a great question. I mean, and it definitely was just that, a logistical challenge, because it all happened, so quickly as far as, being able to get those out, once they were received. And I know, again, it kind of stems down, even though we may be hearing about things nationally, really when it comes to actualizing it, the healthcare organizations are having to help deal with it more at their, state and definitely local, if not county level. So it did take a lot of, players to help make it all happen, very quickly. And if we, go back and remember, when it was all kind of first coming out, there was at least, for us locally, which I think was the case for most everybody nationwide, kind of a tier of who could get the vaccinations.
Yes.
So it started out with the healthcare workers, and then it kind of went into, I'll call them, our nursing type facilities, where we had to make sure the assisted living facilities, the skilled nursing facilities, that we were able to help protect those patients as kind of the next tier, and then on down from there. So as far as like thinking about our making sure that all the employees at the healthcare organizations and the healthcare workers were vaccinated to help protect them, really, I think that some organizations were able to kind of lean into some processes that they had in place as it relates to, if we think about like our annual influenza vaccinations that are provided, a lot of times those create an all hands on deck atmosphere for a fast and furious period of a few weeks to get everybody, vaccinated that way.
Sure.
So we may have clinical folks that aren't in a direct care provider role that are able to kind of pull away for a few weeks to help provide vaccinations. And so again, we kind of leaned into some of the things that we had done in the past, and I know other healthcare organizations did that too. So as far as being able to help do the healthcare providers and workers, I think it may have been a little bit easier than once having to go out into the communities where partnerships were created with communities, with counties, with different religious organizations or community centers to try to create environments that could hold the community members to come in and receive their vaccines. So there was a lot of communication with organizations that we may not normally work with, on a day-to-day basis to be able to help to secure space. Definitely making sure about being able to secure the vaccinations themselves. And then again, trying to be able to schedule the patients. Again, we still had to maintain the social distancing. We didn't want, too many people showing up at any one time. Making sure that we had enough stations set up. Were we going to be able to set up a site that maybe had, 25 stations versus a site that may just have 4 stations? And
right.
Then how can we utilize, community assistance to help with maybe some of the non-clinical positions as far as, greeting and welcoming patients as they came in, getting them checked in, getting them signed in, and then helping to logistically get them maybe to a station where they could receive their vaccine. So again, to your point, a lot of industrial engineering work when it comes to not only the supply chain of it, but the logistics, the scheduling, the staffing, all of that came into play to be able to help make it happen so quickly. And I know that it seemed like at least, for me, knowing what I could see different healthcare organizations doing, but then just as a community member myself, to see what happened and how, places kind of like sprung up, overnight. Right. It seemed that being able to offer services so that, people could come in and get the vaccines as quickly as possible. I know we even had, you can hear about nationally, I know definitely in Atlanta, we've had some of our huge, conference centers and stadiums even opened up to be able to accept patients. And then different healthcare organizations were able to partner with them to help provide, staff members to help provide the vaccines.
That's wonderful. And I guess now it's as good a time as any for a shameless plug to say if you haven't gotten your vaccination yet, there are still doses available no matter where you are in the country. So
yes. And please do. So again, just to plug real quick, I know that we're hearing again nationally about some of the variants that are out. And again, this is kind of what we've experienced the whole time. We don't know exactly what's going to happen when. And in order to help protect and prepare our community members and also our healthcare organizations, please do get your vaccine so that we can help protect all of us as much as possible.
Absolutely. Well, it sounds like, Joyce, you've had from a Lean Six Sigma lens, lots of plan, do, check, act cycles, whether it's in vaccination clinics or the use of data or helping people deal with burnout. It sounds like there's just been a lot of learning along the way. And I was wondering, have you seen that learning shared among different providers throughout the healthcare industry? Are folks open and happy to share when they figure something out?
Yes, I think so. I've been, Society for Health Systems was able to offer, we did a think tank series about a year ago that we had several of our members and even outside folks help provide some information and data just as a pure, sharing methodology. There's other organizations that I've been involved in, professional organizations that have really, taken this opportunity to do a lot more education as people maybe had to do it virtually as opposed to face-to-face to be able to help spread out some information and share it a lot more easily and a lot more quickly. I think that, at least in healthcare, this is going to help springboard maybe some ideas and thoughts that have been out there for a while that haven't really kind of, sunk in yet, this has kind of created those opportunities to make those things happen. So I think there's been a lot more collaboration, a lot more sharing. I think communities as a whole have also been able to, share more than maybe in the past. I think that the healthcare organizations locally as well as nationally have been able to share more lessons learned, what would we do differently? What did we learn from doing it this way? How could we take this particular example or maybe what this particular area did and apply it to something else? So I definitely think that channels of communication have been opened. I think it's allowed even different healthcare provider skill sets, to be able to talk. I think, I know one thing that's been out there is a lot of the telehealth and telemedicine, and I think there's even research out there that this has maybe helped springboard us like 10 years ahead by, just fast and furiously creating things or springboarding things that were kind of stalled out a little bit, from a provider standpoint or maybe healthcare organization standpoint, it's really opened up doors to do that. And that's just one example. I mean, I know that there's several others out there and certainly don't want to leave those out to be able to, hopefully continue heading this in the right direction for the future of healthcare.
It's hard to touch on everything in a podcast, but certainly those are great examples, and certainly there'll be a whole lot more of those kinds of examples at our Lean Six Sigma and Data Science Conference in September 20th through the 22nd here in Atlanta, Georgia, and and excited about seeing folks share not just in healthcare but across lots of industries, share those best practices and share what they're learning. And we're very excited, Joyce, to have you as a keynote speaker at the conference. Can you tell us a little bit about maybe what you're excited about this year's conference, or maybe a sneak peek of what you might be planning to talk to us about a little bit? So, whatever you'd like to share.
Sure. No, I mean, I think, honestly, I'm quite excited to be back in person and be able to see everybody and have the collaboration and the sharing. And I know that we've definitely adjusted, some more so than others, to being more virtual over the past kind of 15 to 18 months. But it's always nice to be able to be in person and to truly be able to collaborate. So I'm very excited about that. And I would encourage, everybody to attend, to be able to hear in your own industry some of the best practices and some of the things that have come out of all of this tenure, that we've been through and that we've been on. And, as far as like a little bit of a sneak peek, I know we're kind of talking, more globally, or I should say more broad, about some of the things that happened in healthcare during the COVID-19. And I'm going to really kind of talk a little bit more specifically from a staffing perspective.
Great.
That's kind of being in productivity management. That's kind of right up my alley, but do want to be able to share some of that with folks as well. Kind of how we were impacted, how decisions were made, how healthcare organizations as a whole were impacted, and some of the things that happened that we don't necessarily think about or hear about in the news as it relates to, some of the changes that happened, at the healthcare organizations through the course of the past 15 to 18 months.
Wow. Well, I'm really excited to hear about that. I certainly not just in healthcare, but particularly in healthcare. It's such a human-driven enterprise. So staffing, nothing happens without staffing in healthcare, and I think that's probably true of a lot of industries that will be represented at the conference. So I'm really excited to hear about that, Joyce. So thanks for the sneak peek.
Sure. excited to be there.
Well, me too. And as you said, it'll be wonderful to share some of those learnings and best practices in person. Certainly having virtual tools to communicate has been a real game changer, I think, for all of us. But I don't think it's a replacement for in-person interaction. So I'm really excited to see smiling faces and to hear about what's going on for everybody in their worlds.
Yes, definitely.
Well, Joyce, thank you so much for joining us today. I've learned a lot, and I can't wait to see you in September.
Yes, thank you. Thank you for having me.
Thanks for listening to this episode of Problem Solved, the IISE podcast, a production of the Institute of Industrial and Systems Engineers in Metro Atlanta. This podcast is produced by David Brandt, Keith Albertson, and Michael Hughes, and edited by David Brandt. You can listen to all episodes of Problem Solved and learn about sponsorship opportunities by visiting our website, podcast.iise.org. You can also learn more about IISE at the Institute's website, www.iise.org.